I've already been introduced. My name is Dr. Abdulshahid Sarki. I'm a consultant nephrologist from the Department of Internal Medicine, National Hospital, ABUJA, Renal Unit. I know that my face is not new to you. I've been coming for a couple of years to deliver lectures related to Ramadan and also health benefits. Here we are this year. Today is 10th of March 2024, preparing for another Ramadan, inshallah, by tomorrow. And I'm here to give a lecture relating to keeping fit and healthy in an Islamic perspective in preparation for Ramadan. Of introduction, side by side, we are going to discuss about Ramadan and also discuss about the health benefits of fasting in Ramadan, and then the tips on how to stay fit and healthy. Introduction: health itself has its own definition. It's the attainment of highest level physical, mental, and social well-being, not merely in the absence of disease or infirmity. Meaning that you can be healthy. It has to encompasses that you have to be physically fit and you also have to be mentally fit for you to qualify as being healthy. And then fasting in the month of Ramadan is one of the obligations in the Arkanul Islam, which is part and parcel of being a Muslim as an obligation for us to fast by the month of Ramadan. And the fasting entails us, after we sighted the moon, then we took niyyah, and then we go for the suhoor, and then we fast from the dawn then to dusk. During the time when the sunset happens, that's when we break our fast, and then that's the iftar. So that's the aspect of fasting in the month of Ramadan. So basically, two things are involved to keep ourselves fit and healthy. We have to be cautious on our diet, that's the food that we eat, and also we have to engage in activities, that's exercise. So mostly what encompasses a healthy diet is a diet that is devoid of low salt. It has to have a low salt. It's a diet that doesn't have high level of cholesterol, and also a diet that encompasses a lot of vegetables, a lot of fruits, and then also avoidance of junks. So mostly in the aspect of diet. Then the aspect of exercise, we have to be active. At least we have to be engaging in exercise at least 30 minutes in most days in a week. We have 7 days in a week, so out of that 7 days, we can keep aside 5 days where at least we'll engage in an activity of 30 minutes, which should be an exercise that should increase our heart rate or make us sweat or increase our breathing. So that's what encompasses that's the exercise that we are discussing about. So the tips for us to stay healthy during the month of Ramadan is to be taking a lot of water. We should be taking a lot of water during suhoor and also after iftar, so that at least we can cover the water that we lost, because now especially the weather is a bit harsh, where we lost a lot of fluid in our body. So if we take a lot of water, we'll replenish that water that we have lost, and it will also keep us healthy. And then we'll also imbibe the habit of taking healthy diet during the sahur and also the iftar. You should have low salt. You should have a lot of vegetables. You should have a lot of We should have a lot of vegetables, a lot of fruits, so that at least we can make it diet that is balanced as well as healthy. We should take a diet that is low in cholesterol. Then also, we can also be engaging in some exercise, especially after iftar, to aid digestion and also to keep us healthy after the exercise. And then sometimes we have some peculiarity where some of us have some medical illness like hypertension, diabetes, ulcer, which we call peptic ulcer disease, and then people that have heart diseases and also people that have kidney diseases. So in that setting, for individuals that have hypertension, they should try as much as possible to be taking their medications during the suhoor and also after the iftar, so that they can be controlling the blood pressure. And they should also be checking their blood pressure regularly, at least 3 times in a day. They should check it in the morning and afternoon, and then after iftar, that's in the evening, at least to have an idea how well the control of that pressure is, and also to be engaging in some exercise after iftar, which it has been shown that exercise can also help you in controlling the blood pressure. And then for people that are diabetic, that have diabetes, that has sugar in their system, they should also imbibe the habit of taking their medications early in the morning, that's during the suhoor, and also during the iftar, after they have eaten their fast. And also they should also engage in checking their sugar at least twice in a day, early in the morning and then 2 hours after the iftar. And then, and then for people that have ulcer, they should also avoid foods that serve as a trigger for that ulcer disease that they are having. So meaning that during the suhoor and during iftar, they have to avoid spicy food, oily food, food that is very hot, and then sour food, and then drinks that have a lot of gas, so that to avoid a trigger of the peptic ulcer disease. And also, if the pains has become so excruciating and they can no longer cope, they can postpone the fasting. It's allowed. And then the people that have heart diseases, also in that case, can also be taking their medication regularly. And then they should also be restricting some fluid, especially if they have some swelling in their legs in that setting, and also reduce salt intake. For people that have kidney disease, if it is early kidney disease, in that case they need to take a lot of water so that they can keep that kidney healthy. But in a setting when that kidney disease advances, they have to restrict their fluid intake, because in that setting when they are retaining fluid, if they take a lot of fluid, it will aggravate the problem. Fasting has its own health benefit to us when we do it, and we really encourage all of us to do the fasting. Apart from the fasting of month of Ramadan, we also have other fasting that we do, at least so that we can get the reward and benefit from the fasting. So one of the benefits that fasting does to us, it improves our cognition. That's the way we think. It has been shown that people that fast think positively, they have a sound mind and sound memory. So meaning that they have a sound mental health and they can form an informed decisions and judgment. So this really helps, because it's one of the cardinal things that maintain the integrity of human being, to be sharp in terms of how he makes his own decision and the way he also think the rational way. Then fasting has also been shown to control blood pressure. So when we engage in fasting, it has been shown also to help in controlling our blood pressure, especially when we put it together with healthy diet. We avoid high salt diet, and we avoid high cholesterol diet, and we take a lot of vegetables and fruits. It has also been shown to control sugar. For people who have diabetes, it has been shown to control sugar, because if we fasted for a long period of hours, there will be a lot of control of that sugar. And then by the time we imbibe in taking good diet during suhoor and iftar, a diet that has less glucose, that will, together with the medication, help to control the diabetes in an individual. It has also been shown to control weight, because weight has been related to so many things, including poor mental health, including depressive illness, including hypertension, including diabetes. Excessive weight has been linked to that, and when we cut down weight through fasting, that will really help in maintaining our fitness and our mental well-being as well. And then it has also been shown to also improve immunity in us, which if we are fasting, we tend to have some soldiers being produced in our system that fight infection that normally used to come to us. So those soldiers will not allow those infections to thrive, and then for us to get sick. And then lastly, it makes us closer to Allah, and then that will make us to have contentment and always feel happy, and then to be closer to Allah, which will improve our mental health and also improve our physical well-being. So these are the little information I came with for the pre-Ramadan lecture related to physical fitness and health benefits during month of Ramadan in Islamic perspective. And another thing is when we look at the diet mostly that our Rasulullah sallallahu alaihi wasallam engaged, mostly is more of vegetarian diet with less protein. When we imbibe in taking more of veggies, so we will reap the benefit from those things. Another thing is exercise. During the time of Prophet Muhammad sallallahu alaihi wasallam, he engaged mostly in trekking. He walks with his legs, which is part of an exercise. So that also helps in so many related, in terms of relationship with the diet, and also in relation to the exercise that we are also leveraging on. So that at least if we imbibe on doing exercise, at least if we the exercise that we can tolerate, anyone that if we can engage in an exercise, especially like trekking or jogging or any other exercise that we can tolerate. So in that case, that will really help in stimulating our system and also making us to be fit and also to be healthy as well. So I think I can end the lecture here. If there's any question, then I will attend the questions. Thank you very much. So it's about the question about drinking a lot of water. So in a medical perspective, at least individuals should take at least 3 liters of water in a day. So meaning that, and in a day meaning that's 24 hours. So if we look at from the time we take our suhoor and the time we break our fast, that's iftar, will be virtually around 12 hours. But we have the whole night before we embark on another fasting again. So we take it 24 hours That's from one suhoor to another suhoor, that's 24 hours. So within that time, we need to at least consume at least 3 liters. 3 liters is, by the way of calculation, if you have 75 cl of nesting water, so you need at least 4 of it in a day. If you have 60 cl of, let's say, nesting water, you need at least 5 of that bottle. If you have like 50 cl of that bottle, you need at least 6. If the sachet water you take, you need at least 6 sachets pure water in a day, because one sachet of pure water contains like 50 cl, that's 15 mils, that's 50 cl. So you need at least 6 of sachet pure water to make it 3 liters. So, but sometimes we do combine with other things which will also consider them as fluids. If you take pap, or if you take some drinks related to, let's say, some juice or any other thing, it's also calculated as part of water. So meaning that the juice, the pap, and the water, we encompass it as part of water. So at least if you can take that amount of 3 liters, so you have taken adequate water that will keep you fit and healthy. So that's based on that. Then I was recently now asked about the issue of taking chill water or warm water during breaking our fast. In our own perspective, in the medical perspective, there is no difference between cold water and warm water in terms of drinking. So because in our own aspect, we know water is water, irrespective of whether it's warm or it's cold. Most important, we have seen that some people are naturally allergic to cold. So for those people who have allergy, in that case, they have to avoid cold water, because if they take, it can trigger their allergy and they can have some allergic response, either allergic rhinitis or any other form of allergy. But in our perspective, water has no any difference, whether it's cold or warm water when somebody consumes it. I have another question which is also related to medical question. The question says, for those who are hypertensive and on diuretics, diuretics are drugs that makes somebody to pee, to lose enough of water. So, and then it's included in their medication. Are they to continue taking this diuretic despite the fact that water intake has reduced? Yeah, basically is, we knew that already if there is adequate advice for that patient, we knew that after, during sahur and during iftar, he's supposed to take the adequate water that he needs for him. So in that case, he can take his diuretics, because that's what will control his blood pressure. Because if he didn't take it, his blood pressure control might not be good. Another thing is, if he didn't take it, when he takes some excess water during suhoor or during iftar, it will not be pushed out of the body. So meaning that he is at risk of having swelling in him. So in that case, he can continue with his own diuretics as a way of controlling his blood pressure. The diuretics, we have different types of diuretics. We have some that we call them thiazide diuretics, and then we have the other one that's our loop diuretics. Loop diuretics are the one that push more water out of the body, while thiazide diuretics push just more of sodium, so that at least they can help the body to control the blood pressure. So thiazide normally doesn't have much problem. Even the loop diuretics, they too, in the setting of fasting, since already we knew that individual will take enough water to replenish what he has lost after that 12 hours of fasting, so he can continue with his diuretics. Okay, by way of advice is, we already made mention that there are some junks, avoidance of junks. Okay, avoidance of junks. which the Coke, that's COK, is part of the junk drink that I have already mentioned that we should avoid during the month of Ramadan. We should engage in taking some natural juices, and then some natural juices that we prepare from our fruits that are a bit natural. But this one has sweetness. Sweetness, that's refined sugars, so they are junks. So it's not a good habit for someone to break his fast using Coke. And then for people that also take cola nut, they are also predisposing themselves to the harmful effect of that cola nut. Cola nut has nicotine, and then already you have fasted. Already your body has less concentration of the water in your system has already been reduced. So by the time you consume that cola nut, yes, by the time you consume that cola nut, nicotinic concentration of that cola nut will be in high concentration in your system. So all the other side effects of that nicotine, including heart rate, increasing your heart rate, increasing your heartbeat, and worsening blood pressure, BP control and other things will manifest in that setting. And all individuals that also have ulcer, that intake of that cola nut will also further aggravate their ulcer as well. Likewise, for those people that smoke immediately after they break fast, because of that effect of that nicotine, in that setting, what your body needs is you need to take a lot of water so that at least to replenish that deficit, the water that you have lost in that 12 hours, so that at least your body will be back to shape after you break fast. So mostly when you break fast, you need to take some fluids, and then you need to take some date, at least, so that at least you can replenish the glucose that you lost, and also you replenish your body with water. That will increase your vigor and vitality after you take the water and break your fast. And then there is another question that was saying, Assalamu alaikum, please, should the exercise be before eating suhoor or after suhoor? We prefer, if possible, to do some exercise after iftar, not before suhoor or after suhoor. After iftar, after you have break your fast and you have rested for some time, you can engage into an exercise for at least 30 minutes after then. That will really help, but not before sahur or after sahur. Because if it is after sahur, it will even aggravate matter. Because during that time, you have been prepared to do fasting for some period of time. So the little energy you have already used it. After you have taken your sahur, the little energy that will carry you for 12 hours, you have already burned it. So in that case, it will aggravate matter. It's better after the iftar. You break your fast, that's when you engage in exercise.
We thank Almighty Allah, who made us all this in the program of Ramadan. Instead with Bismillahirrahmanirrahim, we want to pray to Almighty Allah in the name of This is the beginning of our program. And Almighty Allah, we thank you and we appreciate you. We appreciate it.